Today we'll be providing another update on COVID-19 and how it impacts those with rheumatic conditions. This talk is being given in August 2022. As we always share, data about COVID-19 and vaccines continues to change. Check back here for updated videos or on our website, which has the most updated information as soon as it's generally available. As a brief review, it's been a while now with COVID-19. Started in the world December 2019, subsequently really affecting Alberta and North America in March 2020. We've had multiple waves and multiple variants over that time, with the current variant being Omicron, and even then variants within Omicron, which has changed the coronavirus and what it's looked like a little bit, but certainly enough over the last couple of years. Those variants change how the virus is transmitted, how effective it's transmitted, as well as its severity and impact on our individuals and population. We've been fortunate to develop a COVID-19 vaccine, and while there are actually a number of different ones that are currently available, the ones that are most common, certainly those that we look to in rheumatology, are the ones made by Pfizer, which is approved for those at least 5 years of age and older, as well as the Moderna product, which as of a few weeks ago is now available for those 6 months of age and older. As most of us are familiar, the Pfizer vaccine originally was provided as a 2-dose regimen, given 21 days apart, and the Moderna, again, 2 doses, 28 days apart. A third dose was subsequently recommended, and that was at least 4 weeks after the first 2 doses. And that was particularly with those with autoimmune disease, meaning those with rheumatic conditions and on our medications. And subsequently, a third dose recommended 5 months later after the second dose for those in the general population. Just to be clear on that, because I think there's been some confusion, for those with autoimmune diseases, meaning those with rheumatic conditions, rheumatoid arthritis, ankylosing spondylitis, lupus, vasculitis, and so forth, and on the vast majority of our medications, so methotrexate, leflunomide, any biologic, a third dose is recommended, but it's recommended as part of that initial primary series. In other words, the original recommendation of 2 doses, which is what the general healthy population was recommended, is a 3-dose regimen for those with these conditions and on medications. In other words, 3 doses is really you need to get all 3 of them to be, if you will, as fully immunized from that primary series as possible. Again, that third dose can be given as soon as 4 weeks after the first 2 doses in our population, and 5 months later for anyone else. Since that initial 3-dose recommendation, there's now further updates. For some time now, a 4th dose has been recommended, so a first booster for those with rheumatic conditions and on medications, and that's 5 months after the 3rd dose. And just this past July in Alberta, but really in most jurisdictions, a 5th dose or a second booster is now recommended for those with autoimmune diseases. And again, just to be clear, to compare both the healthy population and those with rheumatic diseases. So right now where we're at is that those with rheumatic disease and on the vast majority of our medications are eligible to get a primary 3-dose series, and in addition to that, 2 boosters. Whereas the healthy population would receive a primary 2-dose series plus 2 boosters. So the number of boosters is the same, and boosters are 5 months after the last of the primary series doses are given. The only difference is that primary dose series is 3 with those with rheumatic disease and 2 for the general healthy population. As a reminder, for the question, is the vaccine safe for patients with rheumatic disease? Yes, all data still points to that being the case, particularly for those with rheumatic disease. The benefit far outweighs the risks. And the majority of organizations fully recommend the vaccine for our population. And this is particularly because there is a high risk for hospitalization and worse outcomes for those with rheumatic conditions and those on our medications compared to the healthy population. How effective is the vaccine? Well, as a reminder, the original data against the original coronavirus showed it was very effective at preventing COVID-19. We know since then with the variants that is no longer the case, but that doesn't mean there isn't value to the vaccine. In fact, where the value really is, and originally the story really should have always been about, was preventing bad COVID, severe outcomes, including hospitalization and death. And the data suggests that these vaccines remain effective at doing that. So again, vaccines effective to reduce the risk of hospitalization and death. And there's some data suggest that effectiveness does start to decrease 6 months after receiving the shot, which is why these boosters about every 5 months comes into play. Now, there is a question of a new form of a vaccine, which is perhaps more effective against the current variants in the fall or winter of 2022, so sometime in the next 6 months. And there's some question if people should delay getting a vaccine now in favor of those. If you receive your second or first booster of the current vaccine now, you should still be eligible for the new vaccine once available. In other words, it is possible to get both. It may not be a choice that you need to get, that you may need to make. As a reminder with vaccines, some thought sometimes has to be made when it comes to some of our medications in rheumatology. So for those who are on rituximab or on higher doses of prednisone, the body has a poor response to the vaccine. In other words, it doesn't make the antibodies and the immunological response that we want it to, meaning the vaccine really doesn't have the effectiveness that we would expect. There are ways around that, but we would strongly recommend to coordinate that with your rheumatologist to optimize timing. Other medications, as listed here, do decrease the response to the vaccine a little bit. There are things that can be considered, but shouldn't always, to optimize that response. And again, opportunity to discuss with your rheumatologist to ensure timing and a path forward is best. And then other common biologics, there's a small concern, but nothing significant, and patients can just go ahead. Outside of vaccines, we now have antiviral treatments available for COVID-19. In other words, a medication you take in the early stages of if you test positive for COVID-19, which again reduces your risk of getting bad disease. It is available in limited quantities, but remains available for those with rheumatic diseases and on treatment. For those who do test positive for COVID-19, we recommend to contact Alberta Health. And the contact information is on our website on the COVID-19 page, and they can do an assessment to see if you are eligible and if it's appropriate to receive COVID-19. Of note in rheumatology, being on a JAK kinase inhibitor is contraindicated for Paxlovid. However, that doesn't mean you should not receive Paxlovid. We would recommend that if you have COVID-19, you would be stopping your rheumatology medications, including JAK kinase inhibitors, so things like Xeljanz or Olumiant, Rinvoq. So it shouldn't be a problem to stop your JAK kinase inhibitor and then start Paxlovid if you have COVID-19, if it's appropriate. Finally, for COVID-19, PCR testing remains an option for those with rheumatic disease. The vast majority of folks these days are doing rapid at-home tests. These tests are good for positive results. In other words, if you get a positive result, it likely means you have COVID-19, but it's less reliable for a negative result, meaning that if you test negative, but you're symptomatic, it's still possible you have COVID-19 and the test is not giving you a true result. In this case, getting a PCR test can be helpful. This is important for those with rheumatic diseases because you are eligible for treatment and you need to test positive to be eligible for that treatment. While PCR testing is available, you can't just sign up for it anymore. You do need a prescription, which can be provided by your family physician, or you can contact your rheumatologist who can provide it for you. And the bottom line with vaccines, again, is they are effective at reducing the risk of severe COVID-19 infection. It is still our best tool at reducing the overall burden for COVID-19, and they can be safely used in our population. Again, this information provided is up to date as of August 2022. We continue to update our website, and we'll post further videos as things continue to change.